Welcome to 9-step sciatica solution. And one of the things that we talked about was the 5 causes of sciatica. And one of the causes is the herniated disc. Important to know where the disc is, but typical spine is 24 vertebrae between the head and the hips. And in between each vertebrae there is a disc. And off the brain is the brainstem, and then the spinal cord runs down through the inside of the spine. And in between each vertebrae, there is an opening where the nerve comes out, called the foramen. And typically, it's in this area where the nerve gets pinched. We talked about this the other day about the sciatica. It's in this area where the nerve gets pinched. There are nerves that exit directly off of each portion of the spine between the vertebrae called the foramen. Now, to understand the herniated disc, you have to understand the structure of the disc. And the disc is like a jelly donut. And it's like a jelly donut in the sense that the outside of the disc, there's a thick material. We call that thick material the annulus. And inside the disc, there's a jelly-like substance we call the nucleus. And the nucleus gives stability to the disc the same way air gives stability to the tire. So when your tire has the proper amount of air, the tire is stable. Just like the nucleus, when it has the proper amount of fluid, it gives stability to the outer wall. Air gives stability to the outer wall of the tire. The nucleus gives stability to the outer wall of the annulus. Now, what can happen? Because the nucleus is like a jelly, is you can start to develop a little tear in the annulus. And that tear we call a fissure. Very often with that fissure, what happens is the nucleus starts to push in the direction of the fissure. And as the fissure starts to tear all the way to the outside, it'll create an opening where the nucleus will push out. And that nucleus is a lot like toothpaste in a toothpaste tube. You squeeze the toothpaste tube, the toothpaste is going to come out the end. Well, the same thing. Nucleus will push all the way to the outside and migrate to the outside of the disc. Now, along that path, there are nerves. So we know that as it tears, you'll get a tear through the annulus. And as that annulus tears, you'll start to develop some pain because on the outer portion of the annulus, there are very sensitive nerve endings. And when you tear through that portion of the nerve endings, it can be very painful. So when you have a herniated disc, it can cause you a lot of pain. It causes you pain for 2 different reasons. Number one, you're getting tearing in your annulus. And that tearing, again, can be painful because it'll tear right through the portion of the annulus where all the nerves are. And that hurts. So we know that it'll cause back pain because of the tearing. But also what happens, and this is kind of what it looks like. This would be the top view, okay, of the disc. The pink portion technically is the annulus, and the nucleus is the gray portion, the jelly. So as the nucleus tears through the annulus, it'll come out to the outside, look just like this right here. So the nucleus pushes to the outside of the disc, and you can see that on an MRI. This is one vertebrae on top of the other with the disc in between. Okay, technically this is the spine, and then the back would be the spinal cord. This would be where the spinal cord is in the spinal canal. Now typically what you want is a smooth transition from one vertebrae to the next. And what you can see down here is that's pushing out. Well, this is the nucleus. It's the nuclear material migrating all the way through to the outside. And as it pushes out to the outside, a couple things are going to happen. Okay, as it pushes out into the area where the nerve is, it's going to pinch the nerve. So we know that you're going to have pain because it pushes through the portion of the annulus where all the nerve fibers are. But also, this is a top view. Okay, so here's the vertebrae with the opening here where the nerve comes out. Looking at it like this, spinal cord on the inside, here's the top view. So technically, we're looking at it from this view right here. And the disc could be in this portion right here, and then the spinal canal would be in the back. So what we're seeing here is this nucleus is pushing out into this area, and it's going to pinch a nerve. It pinches the nerve as it exits the foramen. So 2 things are happening. One, you're getting a tearing of the annulus, and the annulus causes you pain. And the reason it causes you pain is because those very sensitive nerve endings are all located in the outer portion of the disc. But also what happens is you're going to start to get pinching of that sciatic nerve, which can be very painful. It's this area right here. The nucleus is pushed out into that area. That's what it looks like, okay? And as it pushes out, you're going to get that pain that goes all the way down the leg. The sciatic nerve comes out of the lowest portion of your spine. Several nerves come out of this area and come together to form the sciatic nerve. The sciatic nerve is the largest nerve in your body. And when it gets pinched, it can hurt a lot. But that pain goes all the way down the leg. Sometimes all the way into the foot. Sometimes just pain in the foot. But it's this area right here where that nerve gets pinched that causes all that pain down the leg. So patients come to see us. We do an MRI, part of our 9-step process. Second phase here, okay? First phase is education, which is what we're doing today. Second phase is diagnosis, okay? So with the diagnosis, what we do is we have a very specific type of MRI that we do. And with that MRI, we look to see what the nucleus is doing, because it's the nucleus and or the annulus that are going to start to aggravate the nerve that cause the sciatica. So we're looking at the nucleus to see what's going on. Is it pinching the nerve? Are we getting pinching of the nerve? Through the MRI, we can see that. So we look at the nucleus. So this is a patient of ours that came in. And we treat sciatica, and probably we treat more sciatica successfully than anybody because we have the ability to directly affect the disc. So a patient comes in to see us. We do an MRI. And when we do the MRI, in this case, you can see that there is nuclear material that has migrated all the way out of the inside to the outside. And it's pushing into that area inside the spinal canal. So it's going to be pushing right in here. It's going to be pinching that nerve. So we've got the nucleus pushing on the nerve. Okay, do the MRI, put the patient through the program. All our treatments are without drugs and without surgery. We have the ability to take pressure off the disc and get healing in the disc. Now, as he went through the program, this patient, we did a second MRI. We did a second MRI because he was feeling a lot better and we wanted to see what the disc looked like. In his case, it was probably at this point in time 80% better, maybe 75% better. Still had a little bit of pain, still a little bit of aggravation to the annulus, and still a little aggravation to the nerve. Put him all the way through the end of our program, 36 treatments, and we did an MRI at the end. You can see at the MRI at the end, the hernia disc was completely gone. So what does that mean? It means if you have sciatica, that's the result of the herniated disc that's pinching that nerve, we can take the pressure off the nerve. And we can take the pressure off the nerve and free up the pressure on the annulus and eliminate the area or the cause of your sciatica, eliminating your leg pain. It eliminates back pain and eliminates leg pain, but it's all about the nucleus and the annulus causing pressure on the nerve. So we talked the other day, first of all, we have a 9-step sciatica solution that helps us identify the exact cause and treat the exact cause. It's 9 steps. But one of the steps that we talk about is you have to really know what's causing your sciatica. There's 5 reasons: bulging disc, herniated disc that we've talked about today, okay, degenerated disc where the entire disc breaks down, stenosis, which is a narrowing both of the opening where the nerve comes out on the foramen, which would be right in this area here, but also inside the spinal canal, the stenosis, and a spondylolisthesis. And so today's discussion is really all about the herniated disc. So the more you understand why you have a problem, the better treatment choices you will make. It's important to know that sciatica is not just a pain in the leg, that sciatica is a pain because a nerve is being pinched that's going down the leg. You have to identify why it's pinched, what the causes are, and fix that, and then the pain goes away, and that's what we do. It's a 9-step sciatica solution. Thank you. Later in the week, we're going to talk about the bulging disc, and we're going to compare the bulging to the herniated disc, although you're well along this path now, and you're going to have pretty good understanding when you can visually see that the nucleus comes out to the outside. So that's it for today. We're going to talk more about some of the studies, and we'll talk about the bulging disc later in the week. Thank you very much. Have a good day.